Welcome back. It is time now for Aging in Style. So do you know the difference between Alzheimer's disease and dementia? Many people don't.
Yeah, it's really a misunderstood topic. So to learn more about the two and where you can get the best treatment in the state, Scott headed to UConn Health in Farmington. Take a look.
As I begin this story, I want you to meet 3 doctors who are 100% dedicated to their patients and their caregivers. Dr. Christina Zdenis, a geriatric psychiatrist, Dr. Yazid Magaida, a geriatrician, and Dr. Karina Berg, who's also a geriatrician. All 3 are experts in their field and love to help their older patients.
Difficult to get older, and people face a lot of challenges physically and emotionally and in terms of their social lives as they get older. And when thinking about what ways I could really improve quality of life for people, improving their mental health is one way that we can really reshape their outlook for getting older.
Caring for that age group is very special. Need a lot of skills to understand, the bigger picture, the patient's, values, what it means for them, determine their quality of life. And I find as well they need somebody to help them navigate the complicated system. They need somebody to be their advocate, especially as they're going to face multiple chronic conditions, which is the case as we get older.
I love older adults. I love families. We do a lot of work with family members. And I love looking at the big picture and really how we can help people maximize independence for as long as possible.
All 3 deal with patients with Alzheimer's and dementia, which are not the same thing.
So this, unfortunately, is a major misconception and something that we talk to patients and family members about a lot.
Patients and family members that come to the UConn New Center on Aging in Farmington.
The definition of dementia is cognitive and functional impairment that impacts daily life. So if a person has that, if a patient has a cognitive or functional impairment and it means that they are not able to function as well as they used to, or they need help with certain things, that's dementia. There are several different diseases that can cause dementia. The most common is Alzheimer's disease, causing dementia.
And the special thing about Alzheimer and why people talk and ask about it, it is the most common cause of dementia. By far, as we get older, Alzheimer count to 60% or even higher rate of dementia. It could be up to 80% after the age of 80.
When should you or a family member see the team at UConn?
We may lose some of our skills. We may get slower as we get older. Usually, we are concerned if there is persistent pattern of forgetfulness. It's not unusual to forget to pay a bill every now and then, but it is a problem if you are behind, your bills. So, people will be after you, or you have to disconnect your cable. It's not unusual to forget somebody's name here and there, but it's a problem if you cannot remember family members' names and get mixed up about the date and the time and the month. If these symptoms start to become a daily issue, that's the time to seek advice. As I mentioned, a comprehensive evaluation will be important to identify the cause of these changes.
And that's exactly what you're going to get here.
At UConn, we have our memory assessment program. We work with a team that includes a social worker, nurses, geriatric psychiatrists, cognitive neuropsychologists, and our neurology colleagues. And so we provide a team approach to dementia care coordination. We also help connect people, patients and families, with community-based organizations.
Despite the fact this is an ugly disease, all 3 doctors are excited and hopeful about the future.
But it is an exciting time in terms of treatments for Alzheimer's disease because we do have new medications that have been approved. It had been about over 20 years, I think, since the last medication approval, and up until recently, the only medications we had were kind of like a Band-Aid for memory problems. They weren't addressing the Alzheimer's disease specifically. The new medication that has been FDA approved and is on the market is a medication called lecanemab. The brand name is Leqembi. This is a different kind of medication. It's actually an infusion, which means instead of taking the medication by mouth, you have to come in to the hospital for a few hours and get it infused into your arm, like through an IV. The medication does require a pretty significant workup to determine if somebody is a candidate, because not everybody's going to be a candidate. This is really the height of precision medicine. We have to look at what somebody's genes are, their genotype, to determine their risk of different side effects from the medication. We have to look at different types of brain scans and cerebral spinal fluid tests to see if people do in fact have amyloid in the brain this medication would be targeting. So it's a lot more involved than just writing a prescription and going into a pharmacy and picking it up. But we have a very strong multidisciplinary team of our group here at Center on Aging that would be working to keep a close eye on these patients and help them go through that process.
Yeah, you have to be always helpful, and that's the advantage of medicine. More things are discovered.
If you or someone you know is having memory issues, UConn is there for you.
UConn is the only one that provides both specialty memory care and primary care, so geriatric primary care. And what that means is that for many of our patients, we're actually providing dementia-sensitive primary care. This is one thing that is unique about coming to UConn.
For more information or to schedule an appointment, please visit health.yukon.edu.